I had certainly had some concerns. I mean, there is a narrative out there that's being painted right now that I think is very, very concerning. The fear that is being generated by what is being focused on is very unfortunate. And there's no question that abuse and neglect should not be tolerated. We need to learn from instances. Bad actors need to be taken out of the system, and we have some recommendations, policy recommendations that we're putting forth in that space. But what the fear does is guardians are already, and individuals are already in a vulnerable space. When you don't hear the stories, the things that I'm seeing, the messages of hope and growth and connectivity and individuals thriving, when you don't see or hear those stories, it is incredibly dangerous and harmful, I think, to the entire system. And so what I'm trying to do is through my experiences and seeing, being out with members, being out with the individuals, talking to families, is to share those stories that are as important, and need to be heard. Because from a perspective, when you're making choice as to where an individual will live or spend their hours during the day, nothing is more important than their safety. And what I've seen, though, being out in these provider uh, environments, is that safety is not put onto the side. It is front and center. So when instances happen, this is a human system, and unfortunately, things will happen because we are humans. What we need to do is learn from those and put policies in place to prevent. When we create policies based on emotion, it's something that adds a level of regulation that we're not entirely sure if it will move the needle in safety and prevention. We need to really look at data. We need to make decisions in a space that makes sense, that choice is always preserved. I'm trying to, in this role, I think one of the reasons what I think is so important in this role is to really be a listener, have empathy, and really have a deep appreciation for the individuals and the staff that provide the care for these individuals. And I hope that I bring those qualities to this job, and like to think it's really one of the reasons why I was hired in this role, especially now with so many challenges, with potential Medicaid cuts, with story, with such an emphasis on the negative, that my hope is I can come to this role and sort of shed the light on the good things that are happening and work on areas that really need improvement with the provider community, with parents, families. I'd like to get off social media and get around a table. I'm a real believer in connectivity, which is why I'm going out to members. I'm not sitting in my office. The best way for me to learn about this industry is to meet with the people that are impacted by it, meet with the staff that are working in this space, that have the tremendous responsibility of caring for these individuals 24/7, to meet with the execs that have incredibly complex jobs, managing staff, managing budgets, managing the ever-changing landscape, responding to regulations that are coming down the pipe, many which providers don't even have any input on. I think we need to change that. I think we all have to be around the table when policy discussions are being made, because at the end of the day, those policies will be the ones that are best for people, best for families, and most importantly, best for the individuals being served.